Good day. I'm Dr. Marilyn N. D. Ray, and I am here to talk to you about my theory and my book, Transcultural Caring Dynamics in Nursing and Healthcare. And I'd like to tell you a little bit about my background. I am actually a student of Dr. Marilyn Lynn, the first transcultural nurse and nurse anthropologist. So I've been doing the transcultural nursing for almost 35 years now. So I was mentored by Dr. Leininger and able now to develop a specific transcultural framework for caring science. And so my own preparation, I have a doctorate in transcultural nursing. I have a master's degree in cultural anthropology, and I have my focus of research has been studying hospitals as small cultures. Rather than maybe studying particular ethnic groups, I have focused on the study of institutions. And at the same time, however, I have visited many countries in the world and began to understand that there are different caring perspectives relative to each culture, but at the same time we're able to identify certain universals. So this theory is about those universals. And so my framework for this theory has 4 dimensions and 1 central dimension. So the first dimension is the essence of caring, because each culture in the universe focuses on human caring. And in some of my own research and looking at archaeology, for example, we find that the idea of caring and the size of the brain are the 2 most fundamental important elements of what it means to be human. And so caring is a foundational concept relative to what it means to be human. And then the second dimension of my theory is transcultural ethics, which has to do with the moral foundations of our interaction and our principles, our values, and what those moral interactions facilitate in the context of our human dimension and our human relationships. And then the third dimension of my model is transcultural context. So this particular context helps us to identify that each of us is a member we're an individual first, and then we are a member of a family, we're a member of a society and a community, and also that there are different dimensions associated with a particular context, such as in each nation state, for example, there are political elements, and how is a nation governed? Or if we're talking about an individual, we're looking at maybe a governance structure relative to a family life. And then we look at an economic structure or the way in which resources are shared. We also identify a technical element within the transcultural context. And our technology has become increasingly more important as we are all connected in the universe in terms of the internet and social media, and also how is that used also within each family life or each individual for that matter. And also the legal component, the notion of elements of the law or rules of law, and they can be also even, a way in which a family might create a legal, or we might not use that term, but what is right and what is correct for family interactions. And so within this transcultural context, it's all part of, for example, the concept of health. Health is usually determined in each nation by virtue of how the political structure has identified it. For example, in the United States, we have a more individualistic culture, so our healthcare system is more oriented to individualism as opposed to, for example, Canada, where they have a universal healthcare system where everyone has equal access to health care, and that provision is provided by both the federal and provincial governments. Similarly, in England, they have a universal health care system, and all other Western nations. And then in the East, there are different ways in which health care is identified, such as alternative health care. We call it alternative health care systems, but that is the way in which they identify what is the meaning of health to them in these various Eastern nations, for example, China, Thailand, even the Philippines is slightly different, and Vietnam. These are some areas that I've been in myself and have taught this theory. And then the fourth dimension is the spiritual. I call it universal sources, because each culture, individual generally, has a spiritual nature, and that can be identified as a particular religion, or it can be identified as a creative component of one's existence. And so within the dimensions of the theory, we have to look at those elements in relationship to our understanding of each other, ourselves first as a cultural being, and then as we relate to others as cultural beings. And then the center of the model has to do with throughout understanding the nature of culture and transcultural nursing, it helps us develop awareness. So the meaning of culture generally is understood as a rather complex concept, because it encompasses values, beliefs, attitudes, behaviors, and so each of us is a culture, so we also can look at ourselves and understand the nature of our own values and beliefs and attitudes, how those beliefs and values are transmitted from one group to another. That is how we actually identify what a culture is, because it is transmittable from one group or one person to another. And so with this theoretical model, it helps us to determine the nature of our awareness of culture by looking at those various dimensions. And then the second element of the center of the model, or that final dimension of the model, is seeking understanding. Each of us, when we are caring for our patients and trying to also understand our own selves as cultures, subsequently we are constantly seeking understanding, and that is the way in which we facilitate decision making, or the final element, which is called choice making. And so those of us who are involved in caring for patients and focused on relationships, we aren't making the decisions for the patient or the client or maybe a group of people. We are facilitating the choices by virtue of understanding the fullness of the nature of transcultural, and in this context, transcultural caring. And this is a dynamical process, and so that's why I call it dynamics. On a paper, often it looks like a two-dimensional notion, but it's really holographic. So the whole can be in a part, and the part can be in a whole. So subsequently, the meaning of dynamics is looking at something as holographic, and also this notion of emergence, because as we relate to the other, ideas and phenomena are emerging by virtue of our relationship with each other. And so that is an overview of this particular theory. And so looking at what is the meaning of theory, it looks at different concepts, and then how do those concepts, how are they synthesized? And Van Manen, when a major writer in human science, talks about theory as that it has a purpose. And so in this situation, the purpose of the transcultural caring dynamics theory and the model that is on the screen shows that the purpose is to facilitate our understanding and caring for the patients, families, the communities, and even our society at large, and multiple societies, for the purposes of appreciating one another in the sense of what it means to be human.